We know that poverty is really damaging for children's health. In New Zealand, we have had high levels of childhood poverty since the early 1990s, and they have not substantially decreased. New Zealand used to be one of the leaders in child health in the world, and really over the last 20 years or so, we've really lost our relative standing. What happens in childhood has a lasting effect. So your childhood experiences and environments have a long-term impact on, for example, your mental health as an adult, your participation in the criminal justice system, for example, your success at school, and a whole raft of health outcomes like adult heart disease, stroke, obesity, diabetes, and suicide, for example. We've got children in particular groups who are more likely to have poorer outcomes, and I'm particularly thinking children in the care and protection system, children with disabilities, children of prisoners, children of parents who are affected by mental illness or addiction, for example. If you look at the statistics, we've got a really clear pattern of inequality. Māori and Pacific children have particularly poor outcomes on a whole range of different areas of health and wellbeing. And it's not really an issue of the poor versus everyone else. That's really a gradient. So each increase in income, health improves. For death rates, Māori infants and children have a much higher rate than other ethnic groups. And in general, it's between a 2 to 3-fold increase risk of death. For Pacific children, they tend to have the highest rates of infectious disease. And that very much follows the pattern of overcrowding and poverty in our society. Many people are working really hard to improve children's wellbeing. We have had many policies and programs introduced recently to try and address some of the issues in children's health. There are some particularly complex issues such as child obesity prevention, for example, where there have been some movement recently. But our challenge is really in the way that we think about prevention. New Zealand has an ambition to be the best in rugby, and we do very well. And it really is a challenge for us to see if we can develop the same ambition to be the best for our children.